Welcome to Final BDS Made Easy. Here's another question. Describe in detail periodontal treatment of diabetic patients and patients with blood dyscrasias. Beginning with the treatment for diabetic patients, few things need to be considered before starting with the treatment. First is identifying diabetes. Be alert for classical signs like polydipsia, polyuria, polyphagia in undiagnosed patients. Confirm through fasting blood glucose if it is more than or equal to 126 milligrams per deciliter. 2-hour postprandial glucose if it is more than or equal to 200 milligrams per deciliter. Then glycated hemoglobin test if HbA1c is more than or equal to 6.5%, or random plasma glucose if it is more than 200 or equal to 200 milligrams per deciliter. Then assess the glycemic control. Use HbA1c to gauge long-term glycemic control. Aim for glycated hemoglobin below 8% before proceeding with the treatment. Then coming to treatment planning, starting with the non-surgical treatment, perform thorough debridement and provide oral hygiene instructions. Monitoring. Encourage patients to use glucometers before, during, and after long procedures to avoid hypoglycemia. Glycemic control during treatment. Ensure patients consume carbohydrates if their glucose levels are low to prevent intraoperative hypoglycemia. Then during treatment, medication management. Adjust insulin or oral hypoglycemic agent doses based on procedure length and ability to eat post-procedure. Antibiotic use. Not routinely required, but consider tetracycline antibiotics combined with scaling and root planing for better glycemic control. Emergency management. Be prepared for hypoglycemia by having juice or glucose tablets available. For severe cases, administer intravenous dextrose or glucagon. Coming to post-treatment care, maintenance should be done by regular checkups and professional cleanings. They are important to prevent recurrence of periodontitis. Then follow-up should be done. Monitor the blood glucose levels after the treatment and consult with the patient's physician as needed. Then treating patients with blood dyscrasias. First step is identification and assessment. It can be done through history and examination. Identify patients with bleeding tendencies through health history, clinical signs like jaundice, petechiae, spontaneous gingival bleeding, and laboratory tests like PTT, and platelet count. There are some specific blood dyscrasias like coagulation disorders, example hemophilia, von Willebrand disease. For these, consult with a physician to determine necessary factor levels for surgical procedures. Use DDAVP, that is 1-deamino 8-D-arginine vasopressin or desmopressin. For mild to moderate hemophilia, factor 8 or 9 concentrate for severe cases. For von Willebrand disease, consider DDAVP or factor 8 concentrate. Then, for liver disease, perform necessary laboratory evaluations like INR, prothrombin time, and platelet count. Opt for non-surgical treatments where possible and ensure INR is below 2.5 for simple procedures. Then, in cases of patients taking anticoagulant medications, for patients on warfarin, aim for an INR of less than 3 for routine procedures and less than 2 for more invasive procedures. Consult with the patient's physician about any necessary changes to anticoagulant therapy before surgery. During treatment, local hemostasis should be ensured. Ensure complete wound closure and use pressure to minimize bleeding. Consider hemostatic agents like oxidized cellulose, collagen, or antifibrinolytic agents such as tranexamic acid. Careful technique. For patients on anticoagulants, avoid block anesthesia if the international normalized ratio is high, and use infiltration anesthesia instead. Post-treatment management for such patients. Ongoing monitoring. Regularly check coagulation parameters and consult with the patient's physician as needed. Infection prevention. For patients with agranulocytosis or leukemia, use chlorhexidine rinses and ensure meticulous oral hygiene to prevent infections. This much is sufficient for a 7 marker. Thank you for watching. If you like this video, do hit the like button and please subscribe to my YouTube channel. Stay updated for more such videos.